If you're watching this video, chances are you've seen blood in the urine, or your doctor just called and told you that your urine test came back with blood in it. And I know exactly what you're feeling. Panic, confusion, maybe even fear. You're probably searching the internet trying to figure out what this means, and you're getting overwhelmed with worst case scenarios. Take a deep breath. I'm here to walk you through exactly what blood in your urine means, what could be causing it, and most importantly, what you need to do about it. Hi everyone, I'm Dr. Peter Aziz. I'm a urogynecologist and pelvic surgeon. I've spent my career helping women navigate these exact concerns. Every single week, I see patients in my office who are terrified because they found blood in the urine. Some of them have serious conditions that they need immediate attention. Others, they have very easily treatable issues. But what they all have in common, they want answers and they need them explained in a way that makes sense. So let's dive in, talk about what blood in the urine really means. All right, first, let's get the terminology straight, okay? When we talk about blood in the urine, the medical term for it is called hematuria, all right? Before you start thinking, okay, great, another complicated medical word, just remember hematuria simply means blood in the urine. That's it, all right? So here's where it gets interesting. There are two types of hematuria, all right? And understanding the difference is crucial. The first type is called gross hematuria. What does that mean? When you see the blood with your own eyes, whether that's pink, red, tea-colored, cola-colored, there is something different about the urine, okay? The second type is called microscopic hematuria. That's something you do not see with your naked eye, only through a urine test under the microscope. All right, you would never know unless your doctor calls you and tells you, okay, we've seen that under the microscope. All right, so I've had a patient recently, let's call her Sarah, called my office terrified. She said that she woke up one morning, went to the bathroom, bright red blood on the urine. I completely understand the fear. It's alarming when you see blood. It's scary. All right, here's what I told my patient. I want you to understand visible blood doesn't automatically something horrible is happening, okay? And invisible blood doesn't also mean that you're in the clear. Both of them need to be taken seriously and evaluated properly. All right, so why is this important, all right? You might be wondering, why should I care about blood that I can't even see? Which is a fair question, and it's one I get asked all the time. Here's the reality. Blood in your urine is never normal. In the urinary system, I mean kidneys, ureters, bladder, urethra, they should not be bleeding. And if there is blood, even under the microscope, that means something is going on. There is irritation or disease or damage somewhere. All right, now, that doesn't mean it's always something serious. In fact, many causes of hematuria or blood in the urine completely benign and very easily treatable, right? However, we cannot determine what is causing the bleeding just by looking at the urine. We have to investigate, right? So, the American Urological Association, they set gold standards, okay, and guidelines on this. Okay, they say that any patient who has blood in the urine, they need to have proper evaluation to rule out serious conditions. Okay, stay with me, all right? Most people with blood in the urine, again, they don't have anything major. However, we still need to rule out the big stuff. One of the things that we usually see with blood in the urine is urinary tract infections or UTIs. Those are incredibly common, especially in women, okay? In fact, more than half of all women will experience at least one UTI in their lifetime. When bacteria enter the urinary tract, they multiply, they cause inflammation, irritation of the bladder. All of this can cause bleeding, all right? Here's what a typical UTI scenario looks like. You start feeling that you have that urge, you want to urinate constantly. When you do go, only small amount comes out. You feel burning, you feel pain when you urinate. You might feel pressure in the lower abdomen. Sometimes you would see blood in the urine. There are very straightforward to diagnose and treat UTIs. Simple urine culture can confirm the condition. Antibiotics usually resolve it pretty quickly. Here's the important part. Not all blood in the urine comes from a UTI, okay? So if there's no UTI, then we have to look a little bit deeper, all right? So another common cause, Stones, whether that's a kidney stone or a bladder stone, all right? If you've never experienced one, consider yourself lucky, okay? Because those who have experienced those, it's extremely painful, all right? So, kidney stones usually form when salts and minerals in the urine, they can basically form some crystals. They stick together. They can be pretty small as like a grain of sand, or they can be as large as a golf ball. When these start to move down the urinary tract, they can scratch, they can do some damage to the lining, which causes the bleeding. Usually you don't feel anything, but if you feel something, it would be like back pain, groin pain, can radiate to the lower abdomen. Sometimes you can experience nausea and vomiting, and yes, of course, the blood in the urine. How is the stones diagnosed, kidney or bladder stones? Usually imaging, CT scan, depending on the size and the location of the stone. The small ones, they can just pass on their own with just hydration, pain management. The large ones, they can require some intervention, like removing the stones, basically. So now I want to talk about some causes of blood in the urine, specifically in women, okay? Number one, menstruation, or having your menstrual cycle. I know this might seem very obvious, but you'd be surprised how often the menstrual blood can contaminate a urine sample and look like hematuria. So if you're collecting a urine sample during or around your period, that blood can get into the sample, even if you're careful, all right? So a lot of times we just have to repeat those, and most of the time it's negative, all right? Second thing, after childbirth, vaginal delivery can cause temporary hematuria. Usually it goes away on its own, few days to a few weeks after delivery. Another cause of blood in the urine among women is menopause. Usually you see this because there is atrophy of the vagina, meaning when estrogen drops, the tissue of the vagina becomes thinner and it's easier to bleed. It's a very benign thing and can be treated with vaginal estrogen. Nothing to be worried about if you see blood in the urine and the reason is atrophy. All right, third thing, like endometriosis, for example, can rarely affect the bladder, okay, which can cause hematuria that comes and goes every month. Again, this is extremely rare, but I have seen it a few times, okay? Because as a subspecialist, as a urogynecologist, I usually get those referrals to take care of those patients, okay? Now, there is one that is very common, which is vigorous exercise. I know this is actually a fact that surprises a lot of people. Vigorous exercise can cause blood in the urine. This is common in long-distance runners, and sometimes we call it runner's hematuria. Exact mechanism of this isn't completely understood, but the theories, they include bladder trauma from repeat impact, also severe dehydration due to the concentrated urine can irritate the bladder, or even the breakdown of red blood cells from prolonged physical stress. The good news is about this, it's very benign, it goes away on its own with rest and hydration, okay? Again, we can't assume that the blood in the urine after exercise is benign. You still need proper evaluation. So, another thing I want to discuss, which is common, medications. Certain medications can cause blood in the urine. Like what? Like blood thinners. If you had a stroke before, if you had a heart attack and your doctor put you on a blood thinner, sometimes they can actually increase the blood that you see in the urine. However, if this happens, still, the American Urological Association mentions that the patient still needs to get a proper workup to make sure there is nothing else causing the bleeding. So now we get to talk about the serious things that can cause blood in the urine. Number one, bladder cancer, okay? This is a serious cause of hematuria. I know this section is going to be uncomfortable, but understanding these conditions is crucial for your health, okay? Bladder cancer is one of the most important conditions we need to rule out when someone has blood in the urine, especially if it's painless and especially if they are over the age of 40 or they are smoker, okay? Here's what we need to know, okay? Bladder cancer is very common in men, not as common in women, but the biggest risk factor is smoking, okay? It accounts for about half of all bladder cancer cases, okay? Other risk factors can be chronic bladder infections, radiation exposure. The challenging thing about bladder cancer is that early on, it might not cause any symptoms whatsoever besides blood in the urine. No pain, no burning with urination, no urgency, just blood. This is why anyone comes with painless blood in the urine, we have to do a workup. Okay, so the evaluation for this typically requires a cystoscopy. What does that mean? Cystoscopy meaning putting a camera in the bladder and taking a look inside of the bladder. Okay, and also it will include getting some sort of imaging like a CT scan or an MRI to also make sure that the kidneys and the ureters are okay. All right. I've had patients where we caught bladder cancer very early because they came in promptly when they noticed blood in the urine. Okay, early detection means more treatment options and better outcomes. This is why I'm passionate about educating people on this topic. Okay, another serious condition we need to rule out is kidney cancer. All right, kidney cancer can also present with blood in the urine. Like bladder cancer, it might not cause any symptoms whatsoever except for blood. And as the tumor grows, patients might experience some back pain, like a mass, weight loss, nausea, vomiting, but it usually doesn't have any symptoms at all. So whenever you see blood in the urine or your doctor tells you we've seen that under the microscope, this is important to call and make an appointment to follow up within a few days, okay? Even if it happened only one time and you only seen it once and it was not related to an infection or anything else, it has to be evaluated, all right? So you need to do a proper workup, okay? Even if you've been treated for UTI, the blood in the urine hasn't resolved after finishing the antibiotics, you have to be seen again, okay? Bottom line is, hematuria is never normal and it always deserves investigation. Okay, so you made the appointment, you're gonna go see your doctor. What do you expect at this appointment? Okay, what's gonna happen when you go for evaluation? First of all, you're gonna get a very detailed history and physical examination. Okay, they're gonna talk about your medical problems, they're gonna talk about medications, any recent trauma, any symptoms of urinary tract infection, fever, weight loss, smoking history, any occupational exposure, any chemicals you've been exposed to in the past. For the physical examination, the doctor will examine your abdomen, see if there are any masses, any pain anywhere. Also, if you're a female, the doctor also may perform a pelvic examination. After we do all of this, then comes the testing. At minimum, you will need a urine analysis with microscopy to confirm, and a urine culture to rule out any urinary tract infection, okay? Also, the urine culture checks what kind of bacteria it's in there and guide the treatment. You might also get a urine cytology, which is an exam just looks at certain cells under the microscope, like any abnormal or cancer cells. The next step is to order imaging, whether that's an ultrasound, whether that's a CT scan or an MRI, to look for any stones, any lesions, any tumors, or any structural problems with your urinary system. And lastly, you will need a cystoscopy. The cystoscopy, again, is a small camera that we put inside of the bladder to make sure that everything is okay and we don't see anything abnormal. It's a simple procedure done in the office. You usually get some numbing medication and antibiotics. It does not hurt, takes 10 minutes at most, and you go home with no restrictions afterwards at all, okay? So let's bring this all together. If you have blood in the urine, whether you can see it or it was found in a test, here's what you need to remember. Blood in the urine is never normal. It always requires evaluation. Most of the causes are benign, very easily treatable, okay? Like urinary tract infections and small kidney stones. Some causes are serious, require proper intervention, whether that's some sort of bladder cancer or kidney cancer, okay? We cannot determine the cause just by looking at your urine or by how you feel. Proper medical evaluation is absolutely necessary, but don't panic. At the same time, do not ignore it. Call your doctor and get evaluated. I know this video covered a lot of information and it might feel overwhelming, but my goal is to empower you with knowledge so you can be an informed advocate for your own health. If you found this video helpful, please give it a thumbs up and subscribe to my channel. I'll be releasing regular videos on urology, pelvic health, sexual health, and wellness topics. Drop your questions in the comments below. I read every single one, and your questions help guide my future content. Thanks for watching, take care of yourself, and I'll see you in the next video.